of the Health and Community Committee, which will be a hybrid meeting conducted remotely via WebEx and physically in the Council Chambers, Strabane, on Thursday, the 7th of December 2023 at 4 p.m. The roll call, Alderman Darren Guy.
Online, Bright.
Alderman Nairi McMorris.
Online, Barry.
Councillor Jason Barr. Councillor Paul Boggs.
And Shaw.
Councillor Caitlin Deaney.
And Shaw.
Councillor Caroline Devine. Councillor Gary Donnelly. Councillor Alex Duffy.
Shaw, online.
Councillor Sandra Duffy.
And Shaw online.
Councillor Conor Heaney. Councillor Aisling Hutton.
Apologies.
Apologies.
Councillor Catherine McDaid. Councillor Lillian Sinoy Barr.
Yeah, online.
And Councillor Brian Tierney. Here. All right, members, thank you. We've a couple of delays here today, but we're getting there slowly but surely. The next item on the agenda is the broadcasting statement. I would like to remind everyone present in this meeting in Strabane that this meeting will be broadcast live to the internet and will be capable of repeated viewing. This broadcast may be terminated or suspended in accordance with our protocol. Due to your attendance at this meeting, you are consenting to being filmed and to the use and storage of those images for broadcasting or training purposes, or for the purposes of keeping historical records and making those records available to the public. Members and approved speakers are reminded to only use their mics and cameras while speaking at the meeting, or to use the chat facility to highlight a request to speak. A copy of the council privacy notice may be found on the council website at derrystrabane.com. Thank you, members. Our next item, item 5, is our deputation from Darren Melly and Caroline King, who are here to speak to us today. So I'm going to hand over to yourselves, and then we'll allow a wee bit of time in at the end for questions and answers. All right? Thank you. You're very welcome.
That's great. Thanks very much. First of all, just to say thank you so much to council members for having us here. We've reached out to a number of councils, and this is the first one that has let us in the door. So as we know, things are always best in the West, you know. So my name is Caroline King, and I head up the team in Northern Ireland for Papyrus Prevention of Young Suicide, and this is my colleague Darren. So we are just going to go through just a bit about who we are and what we do, and what we're doing here in the West as well. So the organisation, Papyrus Prevention of Young Suicide, was set up 26 years ago by a group of parents who had lost their children to suicide. And as a result, we have a number of resources that we use, and a number of services that we have, which I'm going to talk to you about today. So although we're running 26 years as a UK-wide charity, we've only come into the North in 2020 when I got the job. So I got the job 2 weeks before lockdown. So it was a very interesting first year, I would say, setting up. So we're up and running 3.5 years now, and we have our office in Belfast and East Belfast, and then we have our office here in Foyle in Skeg, where Darren and Joe, our team members, work out of. So there's the next slide is just a short video that kind of really more eloquently than me tells you a wee bit about who we are.
We're here to help young people keep living it.
So as I say, that's more eloquent than anything I'm going to say to you now, but I'm going to go through a wee bit more detail about what we do as an organisation. So the next slide just really talks about the actual issue that we're facing in relation to young suicide. So suicide is the biggest killer of young people under 35 in the UK. The total number of registered suicides for all ages in 2021 was 6,573. And then of that, the number of young people under the age of 35 that died was 1,920. So on average, we're losing about 200 teenagers a year, school age, teenagers a year to suicide. So it's massive figures. And we know that behind those figures, for every suicide that's lost, the research shows that about 135 to 160 people are impacted by those suicides. So when you put our population that we have here, we've just under 2 million people, and you count the amount of people who have died by suicide and then multiply that by the 135, there's a massive population in Northern Ireland that's been affected by suicide. So what do we do? So we do three things. We support, equip and influence. And the next slide talks about how we support. The main way that we do that is through our helpline. It's actually called Hopeline 247. That's an old slide. So our helpline is called Hopeline 247, which operates 24 hours a day, 365 days a year. And we work to support young people up to the age of 35. So young people can call, email or text us for free. So the emails and texts are really popular, particularly with young people and with young men, because it's really hard to do this, lift the phone and talk to someone, but it's a lot easier to do the text and the email. So we get a lot of responses for young people initially searching out, is this the right service for me, by texting and emailing us, and then lifting the phone and ringing us. When they do lift the phone to ring us, our team are qualified. They're mixed. It's counsellors, ex-teachers, nurses, social workers, youth workers. It's a multidisciplinary team of staff that we have on the other end of the phone. And they're there to support the young person to stay safe. So one of the things that they do is, with the young person, create a safety plan. So we have on our helpline, we have a website called HopeLink. So their safety plan is uploaded onto the website. And then they have an individual password that they can go on then and access that safety plan at any time of the night and day. So it's not a piece of paper that's sitting in a drawer somewhere. It's something they have active and live that they can use. And we can track whenever young people are using it. And we know that a lot of the young people that sign up to having a safety contact are using their contract multiple times. So they're going back in and using the plan. So the other thing that we do in our helpline is we support what we call the concerned others. So that's parents, grandparents, aunts, uncles, friends, cousins. If you're worried about a young person, you can contact the line. You can get support for yourself, and you can also get support on how to support that young person that you're worried about. And if you're doing that, you can do it free as well, text, email and phone. And the thing is, all of our services are confidential and anonymous. So you don't have to give any information about who you are or where you're phoning from. And saying that, we are an intervention service. So if someone does tell us that they've harmed themselves or that they are going to harm themselves, they've taken something, we will intervene. We will send an ambulance out to support them. So the third thing we do on our helpline is a debriefing service for other professionals. And this is really popular with the likes of teachers and youth workers. So it's in their work to come across suicide, but it's not something that it's not an everyday task that they should have, but it's something that comes up for them every day in their work. So we have a debriefing service that they can call confidentially and anonymously. And this will be something that we would recommend for your staff and for yourselves, because we know that in the work that you do, in your consistency offices, you're always getting people coming in crisis. It could be housing crisis, it could be, health crisis, whatever the crisis that the person is coming, the families are coming with, having your team supported to be able to know that there's a line there that if they deal with something like this, they can contact that line confidentially and just debrief, look after themselves. Self-care is a big part of what we do and what we practice and what we talk about. So that's our helpline and what we do on that. Our resources are all in the packs that you've got today. So you should have a pack there in front of you that has all of our physical resources. So there's information there on who we are, anxiety, suicide, supporting your child, communicating with young people. There's lots and lots of information there. All of those leaflets are free and downloadable on our website. And they're also, our website's also an accessibility website. So it's, people can translate it into over 100 languages. You can change the font size of the text. You can make the writing bigger. You can get it to talk to you. You can change the color of the text or the color of the website if you have dyslexia or some of the neurodiversities. So it's an accessibility website. We want to make sure that whoever contacts us can access the information that we have. And also then in turn, when they ring the helpline, all of our staff are trained in neurodiversity. They're all trained in gender identity. They're all, they have all got the translation access, so they can use translation services as well. So it's really about making sure that when we put the service out there, that everybody in the community can access it. So the helpline and our resources are the main ways in which we support people. Our equipped end of our organisation is really looking at our training. So this is one of the things that I'm really keen to get councils across the north involved with. We have a session called Spot that happens an hour and a half, and it talks about language in and around suicide prevention. So it's how do we talk about suicide in a safe way? What language should we use? What language should we avoid? And why should we avoid it? And I think it'd be really useful for councillors and their staff to have that training so that they know that when they're approached by someone, not just someone who's in crisis or our family who are struggling, but also from the point of media and things like that, that you know, this is the language that, you know, is appropriate to use and we should use and is safe to use, and the language that would encourage people to seek help. And this is the language we should avoid, and this is why we should avoid it. So that's one of our training. It's an hour and a half. We also have 3.5 hour training, which is more skill based, and we provide training which is assist as well, which everybody kind of is familiar with, is a 2-day intense training, which a lot of community organisations and charities are in need of right now. So the last thing that we do then is our influence, and I'm kind of going through this as quickly as I can because I know busy schedule and somebody wants to get out a wee bit early. So we have our influence part is really about talking to you today, you know, influencing government, from big government, local government, from right across the board, to sort of let people know that this is something we should be talking about. We shouldn't be hiding away from it. We create stigma for young people. You know, I didn't find this out until I became an adult, that we create the stigma for young people because we, unknowns to us, we say to them, oh, we shouldn't talk about, you know, drugs or suicide or sex or these things. We shouldn't talk about them. And then we don't, because we're afraid of the conversations. And that creates a stigma then for the young people. So in order to beat that stigma, we have to find safe ways to talk about these topics. And we know that we have safe ways to talk about suicide prevention. So influencing yourselves, but also influencing young people. As you'll see in our information there, we have got a lot of social media. And, you know, people are mixed about social media. It can be the bane of people's lives and it can be the best thing you've ever been involved in. But for young people, it's very much key part of their everyday living now. And for us, we know the algorithms that are working behind. You know, if I start talking about pens today, you go home tonight, your phones are all listening to me. You'll have pen ads coming up in your phones tonight and sorry about that if it happens, but that's the algorithm. It tells you, oh, you like this, so we'll send you that. So for young people, we try to encourage them to go onto our TikTok page, our YouTube page, you know, look at our videos, look at our blogs, because they're all about positivity. They're all about hope. They're all about finding ways to help yourself. And looking at the things that you might find, whether that's to keep you safe, whether that's a pet, whether it's a friend, whether it's a religion, whatever it is, that are the things that keep positive for you. So we're trying to influence young people in that way, to sort of say to them, look, this is how we can support you to keep well and stay safe. So I'm going to stop there. Hopefully that's not over time. And if you have any questions, I'm more than happy to answer them, if I can.
Thank you very much. Thank you very much, Caroline, for that. You'll be glad to hear you're not over time. I think there is no time limit on such an issue like this. If I could just make one small point, some of our members online have reported that they had no audio during the video, and if that could be emailed maybe to the committee section, so we can email it out then to to the members?
No problem at all. I can email the whole presentation out. Yeah.
Great, thank you very much for that. I'm going to open it up now to the floor. And the first indicated speaker is Councillor Boggs.
Very good, Chair, and thank you very much for the presentation and for the video. And I'm not sure if it puts it more eloquently than you can, but it's very helpful just sometimes whenever you have something to watch and to listen to, as well as you speaking. But I know that all members and council officers even will engage with young people on a regular basis. I myself am a teacher and come from a teaching background along with Councillor Deeney, and we work with young people every day. And that part that you said around, you know, not waiting on the conversation to start, but starting the conversation. I'm sure anybody who works with young people or even parents will agree that when a child, you know, there is something wrong, whether by the look of them or the mood, the first thing that you say, "Are you okay?" is when the floodgates open and everything comes to the surface. And if you don't start that conversation, that can stick and stick and stick. So I think for the first time, maybe that's something that we've seen in your presentation that I maybe haven't seen in others before, and even the training that we would do in school. It's all about how we help. But sometimes how we help is just by saying, "Are you okay?" And starting the conversation for that young person. It's probably the first time as well that I've heard an organisation coming in and talking about the other people that are involved, because yes, while the person who is in a very distressing situation is obviously the priority, it does have that knock-on effect. And like that statistic that for every one, you know, suicide or attempted suicide, there may be a ripple effect of 135 plus people. Like that's something shocking, that there would be 135 people negatively impacted. That, in my opinion, and I'm sure others would agree, those 135 are maybe forgotten about in a lot of situations, and the focus is all on the person who has either found themselves in that situation, found a way out, but for some don't. For a vast number don't. So I think that debriefing, particularly for social workers, teachers, anybody who interacts, I know people that work in constituency offices and the rest would find that very often, that when you get that situation over, it's only then you realise the severity of what you were dealing with, and you would need that. I commend the work that you're doing in relation to looking at all the different ways that particularly young people could get in contact with your services, texting. I know our students are TikTok crazy and Instagram crazy, and I suppose it's finding different ways to engage with them, and it sounds like you're doing all that. So I just wanted to commend you for that. I'm not sure, Chair, if we need a proposal. I'm not sure if it is a proposal, but I would encourage maybe if council officers could go away and look at, is there a gap in our own training plan for members and for council officers? If there is a gap, then maybe that we would consider linking in with an organisation such as yourselves to provide that. If we need a proposal for that, I'm happy to propose it. But I think it's because I think it's very, very important. I think you've raised something today that maybe we haven't thought about before, about that the other people affected and that kind of debriefing mechanism. So I'm happy for that, for member services, maybe even to look at that coming out of this year. I suppose the only question for me, and it is coming from now this role as a councillor, in your view, if you can, what more do you think we could be doing at a local government level here in council? And then obviously we are all very aware of the impact of not having an assembly and executive to kind of deal with the mental health crisis here in the north, and indeed right across the island and right across these islands. But I suppose just very briefly, if you don't mind, what more could we be doing as elected representatives in order to kind of plug the gap if there is anything there that you think that needs looked at? Thanks, Chair, and thank you very much again.
Thank you, Councillor Boggs. I'm going to just take them in batches, and then I'll allow you time then to come back in. But in relation to Councillor Boggs's proposal, I'm pretty confident that proposal will be supported by everyone across the chamber. So I'm happy to just ask officers to engage with member services to see if there is a gap there, and to see what we can do if a gap is identified, to try and plug it. But we're happy to move on with that. The next indicated speaker is Alderman Hussey.
Thank you, Chair. I'm not a member of committee, and I can't second what is a very worthy proposal, but I support it. Can I thank you for being here? A phrase that you used that impacted on me very much was, where suicide is preventable. The reason I say that, 30 years ago, my younger brother took his own life. And I was with him the night before at a social event. And to this day, I still say to myself, was there something that I didn't spot? And I suppose it's that issue of recognize when you are being approached. And if you can expand on that, I would really appreciate it. I note that you work with under 35s, who was actually 35, and a well-settled young man, married, 2 kids, successful in his job, etc., etc. So if you can expand on that recognition issue. And is there a case where the person who has reached that stage, they're totally prepared, and they go into that state of calmness, shall we say, and say, right, this is it. I've decided what I'm doing, and it just progresses. Similar then to Councillor Boggs, the impact issue. The 135, and I suppose we have heard of cases where a young person has taken their life, and then all of a sudden there's this cluster, which can be extremely worrying. Not alone those who may succeed in taking their own lives, but the impact that it has on those folk, and indeed the whole family and friends and associates. So, I can perfectly believe that that can spread out to 135 people. But I sincerely thank you for being here, and I hope that you can get the recognition that you deserve, because through that recognition comes the approachability then that is afforded to you via that recognition. Thank you.
Thank you very much, Alderman Hussey. Next on the queue speaker is Councillor McDade.
Thank you, Chair, and thank you very much for coming on and giving us your presentation. Similar to Councillor Boggs and Alderman Hussey there, it was brilliant. It was really informative, and same as Councillor Boggs, I love a wee video as well. I love to see the different voices and the told you like. I suppose for me, I work in mental health, so suicide isn't an elephant in a room for me, but I know it is for a lot of people. And it's I think you're dead right. It's about having that conversation and having the confidence to say the words and speak the words and take that stigma away. And it's something I think we need to be doing all the time. It's not comfortable to start with, but I think the training is a great idea, because certainly I know of people that whenever we've asked them, are you thinking about suicide? Are you thinking about hurting yourself? It has made a difference. So I think the more training, the more people are confident to do that, the better. I think it's brilliant that it's up to age 35, because there's so many people fall between a gap between children's and adult services within statutory services, that this kind of bridges that gap a wee bit, doesn't it? And I think it's something that's really important. In my own personal circle, we lost 2 people who were 28. And they couldn't get into statutory services, and we didn't really know what else there could be done. And and I think that you can't say, I mean, whether if they knew about this might have made a difference or not. It probably wouldn't have, because similar to what you've just said, Alderman Hussey, sometimes the decision has been made and we can't look back and think what if. But I think it might have made a difference to maybe even the family and the friends around them. Also, I think at the minute, I'm actually supporting somebody who has a child who's suicidal, a teenager. So I didn't know about this. So this is something I'll bring back to her now and show her, and hopefully she'll maybe make contact. I suppose working in mental health services in Derry, I didn't know about this. So this has been really educational outside of my council role. It's something that I'll bring now to my working role as well, and make sure people are aware of it. And I do work with adults, but they're up to 35. There's 18 to 35-year-olds there. So it's another charity or community and voluntary that we can reach out to and use and signpost people to, as well as the statutory services. And I suppose if we're going to talk about the things that stood out, a few months ago we had a delegation on here about hope, and that was another word you used. And I think it's something that we need to start talking about more and meaningfully, is talking about holding on to that hope for people whenever they're maybe in crisis and they don't have any hope. Well, we can hold it for you until you're ready to take it back, and we'll help you kind of get to that point. But I think I don't really have any questions apart the safety plan. I'm interested in the safety plan. I'm just wondering, is that linked? I know we have safety plans within the trust as well. Is that linked to the trust safety plans, or is it separate? Is it, I know you said it was online. Can they print it out? Do they have it on their phone to bring to their GP or to their CPN or whoever it might be, just to see if there is a link there? But I thank you very much. Really brilliant service. Thank you. And I'm happy to second if we need a second the proposal. Thank you.
No worries. Thank you, Councillor McDade. I'm going to hand back to Darren and Caroline now to see if they want to address some of those issues that were raised.
Brilliant, yeah. Thanks very much, and thanks to everybody again. I just really appreciate getting the opportunity to speak to you all. So I suppose, Councillor Boggs, your question, what can the council do? Well, we work in partnership with a lot of the organisations across Derry and Strabane District Council, and one of the big things that has been pushed, and any chance I get an opportunity to push it, is to talk about the bridge and the work that has been stalled on the bridge. You know, every year we have a number of people that die from the bridge or attempts on the bridge, and the very fact that people see the bridges as an opportunity or a place to go to in relation to ending their life, we can very easily remedy that if we take that away. You know, we know that cutting out access to means reduces suicide massively. We've seen that. We've seen it internationally. We've seen it in things like, you know, there's a reason why we can only buy one packet of paracetamol now. That was down to suicide prevention. It massively reduced the number of overdoses. There's a reason why we have catalytic converters now. It's all down to suicide. So, you know, we very rarely now hear of people ending their life in that way. So, you know, by pushing, you know, where you can with, I know the Department of Community is involved. I know there's lots of different people and lots of different wheels in turning, but to have, you know, that push forward to sort of say, look, what will it take to get us over the line with that? Because it's been 10 years in the making. And, you know, over that period of time, like if we look at the deaths that occurred, you know, they are preventable when it comes to the bridge. Do you know what I mean? So that's one thing. But as a teachers as well, just to say that we do have a schools programme that we run as well, that we work in schools, and we've started working with a number of schools now in Belfast, and we've been in touch with a few schools here as well. So we're hoping that'll roll out over the coming months. So Alderman Hussey, just to say, I'm really sorry about your loss for your brother. For me, I've lost 2 friends and a cousin to suicide. And I always, at the time, I remember thinking, you know, there was nothing that anybody could do. This was their decision, that was it. But after 16 years of working in this field, I kind of think if I had known then, what I know now, I just wonder. I don't know, and I can never know for sure, but I do know that suicide is preventable. And you know, for most people, if we get the right thing at the right time, that's what can happen. But it's finding that thing. So one of the things that we do in our training is our 3.5-hour training. We support people to spot the signs. So that's one of the things that we do. We look at how do we spot the signs, and also how do we create the safety plan with the person. So those are things we train people on, so that they can have that further conversation with someone that is not just the initial conversation, but goes on further than that. So that's some of the things that we do about recognising the signs and what might people need to look for. We believe in suicide, like for the years that I've been doing this, suicide for me is everybody's business, but nobody should do it on their own, which is why we have on our helpline, we say to young people when they ring the helpline and they're worried about a friend, we say to them, look, you're doing the right thing by ringing us. You know, when we tell them, if it's in schools, we say to them, look, you've done the right thing by speaking to the teacher. You know, you have to involve another adult or another person in that. We don't do this work on our own, and we certainly don't expect, and we'd be seen as the experts, although I hate that word. But, you know, so I don't think, we don't think anybody should do this work on their own. So everybody should have somewhere to fall back on, which is why our debriefing service is really important, particularly for the likes of your staff and your constituency offices. Just to say to the impact, and you know, you're talking about clusters and the impact. You know, we do have we do have a thing called contagion that goes back, like it's been researched for years and goes back into the 17th century actually, where it can happen whenever a suicide happens that's either high profile or well known, that other people who are feeling that way can think, well, actually, this is, if that person can do it, I can do it too. So this is, it can create a contagion. And we know that we've seen enough of that in the West here as well. So a lot of what we would do is work again with the Public Health Agency. I sit on the Western Protect Life Implementation Group and sit on the regional group that's chaired by Michael McBride. And what we look is community planning around how do we support the community whenever something like that is emerging. So we're very much linked into all of that and how we support if we see something happening that is worrying like that, so that we can try and get out there and prevent and let people know there is hope. And just to remember, we cannot put this idea in someone's head. You know, if we talk about suicide, it's not going to all of a sudden make somebody think they want to end their life. It's just not going to happen. We've loads of research to show that that is not the case. If someone is thinking about suicide and you ask the question, you will ultimately have them either be relieved you've asked it so that they can talk about it, or they'll immediately say, "Oh no, I'm not that bad," or I'm not in that way. They'll give you a reason for that. So there's no nothing bad can happen from asking the question.
And I think, sorry, just to touch on that, as you mentioned there, it's about normalising the conversations at your level, government level and policy level. 1 in 5 people have suicide thoughts, and that's okay. It's not taboo. But it's about having the conversation and being able to speak about it and knowing how to speak to young people about that. You know, thoughts are not facts.
Mm-hmm.
So they're having these thoughts, but they're not facts. And it's about reiterating that when we're talking, especially when you're thinking of your classroom. If it's 1 in 5, that's 6 people in a classroom having those thoughts as well. So it's about bringing up the conversation and speaking about it confidently. And that you can't do no wrong if you ask somebody, if they're not feeling something, if you're seeing signs and somebody's being distressed, or a child you know that's not being themselves, you're not going to do no harm asking them, are you having thoughts of suicide? But it's about you having the confidence to say those words. And our training involves how do we speak about that confidently as well.
Yeah. And then Councillor McDade, just to say about, you know, the transition, the reason, one of the things that I love about and was attracted to joining the organisation was the fact that we work up to the age of 35, because we all know we're sitting in this room and I'm looking around thinking everybody's over 20 anyway. Yeah. So I'm hoping just about. So I can't see anybody on screen. They're probably younger than that, but yeah. So we know that, like, first relationships, moving schools, first buying your car, buying your house, you getting a pet, you know, married, divorce, all those firsts usually happen within that first 35 years of your life, you know, and it's at those points and those transitions that you will find that people fall through the gaps, you know, because those are the most stressful points in your life. So that's one of the reasons that we used that transition, that 35, because, you know, life doesn't become peachy once you turn an adult at 19, you know.
Also, to touch on that too, that doesn't mean if anybody was over 35 that they would be refused advice or support from us. You know, they would be signposted on, or they would be helped in whatever way we could.
Yeah. And then just the other couple of points on hope. Hope's a seed, you know, and if we feed it, it grows. So that's really important for us. And that's why our helpline is called Hopeline 247. Our Hope Link is called Hope Link. You know, and we do a lot. We have each year, this year we had a massive Hope Walk that ended up in the Guildhall, and the Mayor of Derry and Strabane District Council did a fantastic talk to all the young people that turned up, drenched and all as they were. But it was a really successful event, one of the biggest ones we've had, you know, since we came to Northern Ireland. So really pleased to have that. And it is just about generating hope, creating that an idea that, you know, we can grow this in people. And as far as the safety plan is concerned, there should be one, there might be one in your pack. If it's not, yeah. So that talks about our safety plan and what it is and what it looks like, and why it should be used. And for the young people, when it's set up, it's an electronic version, so they have it 24/7, 365 days a year on their phone, on their device. They can print it off if they want to, but for most of them, it's about being able to act, for young people, they tend to want to just have it on their phone. And we encourage them then to call us back if that changes. So, into your safety plan, you might put things like a pet or, a friend or something like that. But if the relationship breaks down or the pet dies, you don't want that every time you're reminded, so we've encouraged them. That's a way to encourage them to keep in contact with us too. We're not a long-term service, as in we want them to phone us every week for like 6 months. But we encourage them to call us whenever things get tough for them. So we never kind of finish off. We sort of say, look, you need us again, you ring us again, so there's no kind of cut off with it. And I think that's all answered, unless anybody has anything else. And
Councillor Jason Barr.
Thank you, and thanks again for coming in for such an emotive presentation. It's always a very emotive topic when suicide and suicide prevention is discussed at any committee. But just as my role, also I've seen firsthand how devastating this can be, and as Councillor Boggs rightly said, how it impacts the wider circle around. Like in my other job, I've had the unfortunate task of cutting down suicides and then watching a mother come in to a room and comfort and hug their child, which is very, very awful to watch at times. About 11 years ago, we lost a friend in our school wasn't to suicide, was to drowning. But one of the most amazing things happened after it. And I don't know who it was organised by, but it was organised by someone where there was about 150 of us were told on the day after the funeral. We went down to the Alley Theatre, and the Alley Theatre was set up, and there was a lot of organisations there. There was like suicide prevention, about help after, how you could deal with death, different things. And I thought it was absolutely amazing. And I think it's something that should happen, and it should be rolled out across council areas. And I'm not saying for council to roll out, but just for what yourselves and organisations to keep, when somebody does commit suicide within a community, where you step in and offer that service after or on the day of the funeral, even before it, just for to entice young people or whatever to come in and say, look, they usually helplines or whatever if you're ever feeling down, because I think that's a good time when people are at their lowest and at their saddest, to grab them at that time and to let them know that there is help and an opportunity out there. And just to say, Derek, from knowing you for a long time, I never understood or knew that you went through that in the family, so I'm very sorry to hear that. But look, thanks very much for coming on and for the amazing work you're doing. Keep continuing the amazing work. Thanks very much.
Yeah, absolutely. And we're part. There's a new group that's starting to. It was up and running before COVID, and it kind of fell down, and it's going to be coming up again now. And that's it's very much a community based organisations coming together to look at what they can do in and around suicide prevention. And that it's been the Trust, the Western Trust, and the Public Health Agency are leading on pulling that group together, and we're going to be part of that. And that will be part of the aim, is that we look at certain times in the year and we go out and we promote services. But it's also a connection into the community response plan, which is already up and running. That if there is a death in the community and there needs to be a response in that community, that the trust will lead on that, and they will take who they need in to basically do exactly what you're saying, whether that's set up counselling services, advice services, letting people know, like I'm a counsellor, a trained counsellor, and not like you guys, and a qualified systemic practitioners who work with families. And I those services are absolutely essential. We need to have them. But the other thing I would say is, like, one of the sessions I had with an older man in his late 70s who came into to have some counselling with me because his family had sent him because he'd just recently lost his wife of 50 years, and he was feeling like he wanted to be with her. So the family thought he was suicidal, so they brought him to me, and they'd got him a dog as well. And the first 2 sessions he came to me, he just kept moaning about the dog. The dog was doing his head in. It was peeing everywhere, and it was eating his skirting boards, and it was just doing its head in. And I found in his local community that there was a dog walking club. So I said to him, look, why don't you go down to this dog walking club? Look, and in the worst comes to the worst, they're all dog lovers. They'll take the dog off you. So he headed down to this dog walking club, and he came back to the next session the next week, and he said, do you know what? I met such and such and such and such, and I haven't seen them in years, and I'm going to go every week. And for me, it wasn't that I did anything spectacular as a counsellor in all my training. You know, it was nothing that actually, it was the fact that he had that connection with other people, and that's what he needed. So for me, it's about having the right thing at the right time for people. It's not about, you know, statutory services are overwhelmed. What we do in community and voluntary sector is immense, and working along with our statutory partners, we can try and support them to keep the most severe go to their doors, and then we can support with the rest. So it is really about working together and, as I say, growing that hope.
Thank you both, Darren and Caroline, for coming here today and giving us a presentation. I think we can all see from the presentation and your responses how passionate you are about the work that you are doing, and I suppose how confident as well in the practices that you are putting across. There's some things there that challenged me, particularly when Darren said, you know, about asking, "Are you having suicidal thoughts?" I think it's more, as opposed to being afraid of asking that question, it's being afraid of the answer. Is on the other side, and I think we have to try and address that as well, and giving people the confidence that they know if the answer is what they suspect it is, what the next steps they are to do to try and support that person and help that person. But your organisation is one of the key ones to do that. And I suppose from a council perspective, what we should be doing, and I know Councillor Boggs asked us, is promoting your services as well, and making sure that they get out across our city district, and that young people up to 35 are aware of the service there, and that we can do all we can to try and direct people that way to try and support them. But look, on behalf of this committee, I want to thank you for coming along, and for the work that you're doing across this district, because it is absolutely invaluable to all of us. I hope, in a strange kind of way, I hope that you don't become too busy, because that way means that there's not a lot of people thinking or having suicidal thoughts. But from our point of view, we certainly do all we can to support you, and if there is anything we can do, just get in touch and we'll certainly do it. Some of the members who are online have asked if their packs could be collected, and they will collect them either from member services or at full council. Can that be arranged? Yep, thank you. But look, thanks very much. Shall I go ahead, Caroline?
You know, just to say, in your packs as well, you have a little key ring for, everybody loves a wee key ring for the trolleys. But just to say, on the back of it is a QR code, and that takes you directly to our website. So if you are out and about and you're speaking to constituents or anything, and you want to give them the helpline number or anything like that, it's on the back of the thing. Just go there. Thank you very much.
No worries, folks. Thanks very much for coming today. Thank you. Okay, members, item number 6 is chairperson's business. You'll be delighted to hear that I don't have any issues. I want to reference one small issue myself. Tonight, former Councillor Tony Hassan will launch his own book in the Chantal Community Centre. I was on council for 8 years and a DEA colleague of Tony's, and I just want to take this opportunity to wish him all the best with his launch, and I hope to get there. So if we can rattle on and get through this, I'm going to move on now to item number 7, and that's the matters arising from the open minutes of the Health and Communities Committee held on Thursday the 16th of November, pages 11 to 28. Councillor Boggs.
Just a very quick one, Chair. I had asked questions on and around of the trust on and around the Western Urgent Care, and in particular the issues in relation to our GP services, particularly in Strabane. But since I raised that, I've been made aware of other ones right across the Western Trust area. Ms. Malloy, had said that it belonged to, it fell under another kind of unit or group within the trust. I am aware from speaking to other councillors that group, the Strategic Plan and Performance Group, SPPG, have been in committee before, but it's been some time. So I would like to propose that we get the committee clerk to maybe write out to them again and ask them to come on in a future deputation to present to the committee.
No worries. Councillor Boggs will get that organised. Thank you. Alderman Hussey.
Thanks for the opportunity, Chair. 215 local air quality management. As Councillor Devine had welcomed the new air monitoring station in Castleberg. Of course, the success of these is perhaps location is an important factor. Not being a member of committee, where exactly is the monitoring station? Do we know? And if not, can we find out?
Through you, Chair, it's intended to be on a council premises, but we'll liaise with you in terms of whether the suitability of that. I don't actually offhand know the particular location, but it will be probably on council land.
I think it was mentioned that it would be at the leisure centre.
Okay.
I just would query that as to its effectiveness given the topography of Castleberg. But I'm not the expert, so if it has to be on council ground, well, I suppose that's as near as you're going to get to where it might be needed.
Through you, Chair, it doesn't necessarily have to be in council land, but there is criteria in terms of where it's located. So we have to follow the department's guidance in terms of the traffic flow, residential housing, that type of thing. So we are restricted that way.
Thank you, Alderman Hussey. I have one item myself that I wish to raise. And apologies, Seamus, because I don't have the page number or even the item number at hand, but it's I wonder, could we get an update on the pet FBI situation? I know we got an update last month, but I understand from some media and social media that it might have moved on again. So could we have an update, please?
Yeah, Chair, I'll try and be brief, but it's important we probably set the background to the service that we provide in terms of collecting stray dogs as well. So contrary to the update I provided last month, Pet FBI have terminated the lease and vacated the premises in Pennybourne Industrial Estate. So the background is council are required, statutory required to collect stray dogs and keep them for a period of up to 5 days. If they're not reclaimed after that or within that period, then council can rehome them. So the kennels in Pennybourne have been council ownership for about 20 years, and there's approximately 20 kennels in that facility. At one point, council would have impounded approximately 1,300 dogs per year, and a large majority, and that's going back to probably the late 90s, and the majority of those would have been humanely destroyed rather than rehomed. Thankfully, things have changed, and we're now at a stage where we would collect probably under 100 dogs per year, less than 2 a week. So, and the majority of the dogs would be rehomed as well. I think we would only put down dogs if they're involved in attack or they just weren't suitable for rehoming. So in 2019, council officers brought a report to this committee to carry out a tender exercise. That tender exercise was unsuccessful. We were subsequently contacted by Pet FBI who submitted an expression of interest to lease the facility at a reduced rental rate than they had previously been paying at the other facility, substantially reduced. So that proposal was brought to this committee and approved in 2020, and it was a 3-year lease. Relationship with Pet FBA and the service they provided was excellent, and there was never any queries or concerns raised in terms of the rent or the condition of the facility. It's important to note that council would have carried out periodic inspections to ensure that we complied with health and safety regulations. The animal welfare team would have inspected the premises, and so the statutory requirements were complied with. We do accept that the premises had deteriorated over the period of time, and there was a schedule of works put in place, and that had been communicated with Pet FBA in terms of chipped plaster of the walls of the kennels. And so officers do acknowledge that, and those works will be carried out. So Pet FBA have given us formal notification that they're terminating the lease and they have ceased to operate. Council will continue providing that service because we're statutorily required to, and we'll bring a further report back into this committee outlining options in terms of service going forward. Thank you.
Thank you for that, Seamus. I have one indicated speaker at this stage, and it's Councillor Sean Cusick.
Thank you, Chair. I'm not a member of the committee. I appreciate you letting me in. Seamus, obviously, I've been contacted quite a lot, given my interest in animal welfare, with especially in relation to what was on in media and Belfast Live in particular, and the photographs. And I am, like a number of my constituents, very concerned about the condition of the kennels at the moment. And given that the Pet FBI are have ceased to operate as of immediate effect, what emergency plans have we got in place to sustain the operations, first of all, over what's going to be a very busy period? Because we all know that during Christmas and that, people get animals and within a few days, you know, they abandon them or surrender them. So, you know, is council able to cope with that situation, firstly? And secondly, I was alarmed at the condition of the kennels, and really surprised that we were operating in that way as a council. So how quickly can they be brought up to standard? You've already acknowledged that they have deteriorated, despite, you know, there were inspections, but, you know, what's acceptable to one person isn't acceptable to another. And given what I saw online, whether that be right or wrong, or whether it be exaggerated, I was really shocked, and a number of my constituents have contacted me quite outraged, and that's embarrassing. As a, you know, a council, it's supposed to be caring of animals and looking after their welfare. So those two questions would be, first of all, what's the emergency response to cope with what's going to happen of immediate effect with regards to stray dogs, animals, etc., and looking after them, and, you know, replicating the service that FBI had provided and excellently provided. And it's unfortunate the relationship broke down. And secondly, what is going to be put in place for, you know, to bring the provision of animal care up to scratch? Thank you.
Thank you, Councillor Cusick, for your question. A couple of points there. You know, the council will continue providing that service forthwith, and the dog wardens will be occupying the premises, feeding the dogs, collecting the stray dogs, and so there's no difficulty with providing the service. There's capacity in terms of the number of kennels that are available, and we'll continue to work on with all our rehoming charities in terms of having those dogs rehomed or returned to their owners. It's probably fair to say that, you know, the media coverage probably doesn't, in my personal opinion, reflect the overall facility. Yes, there's chip plaster off some of the kennels. As I said earlier, complies with health and safety regulations. Personally, I believe it complies with animal welfare regulations as well. It's going to cost a very small amount of money to have them upgraded, and we plan to have that done ASAP, and that request has been submitted. Now that the tenant has left, we will carry out a further assessment of the facility as well. It's important to note that some of the photographs were of an old store that were not even used, wasn't used. So we'll continue providing the service and liaising with other animal welfare charities. And it's probably important to note that PETA FPA, it's not that they had difficulties working with the dog wardens and then they decided to move premises. They've ceased to operate. It's not as if they're moving to another premises. And so we'll provide a further update on the service going forward.
Thank you very much for that update, Seamus. Thank you, Councillor Cusick. Any further matters arising from the minutes? No? Okay. Item number 8 is Seamus as well, the annual health and safety consumer protection plan.
Members, the report relates to the Health and Safety and Consumer Protection Service Plan for this year. The plan covers the joint strategy between the Health and Safety Executive and councils, which have a dual role in terms of inspecting premises in the council area. It also covers the regional work plans and the service demands, resources and emerging issues. In terms of consumer protection, the plan also covers work required in relation to EU withdrawal and the Windsor framework. And members, you'll be aware from previous committee reports, OPSS have provided funding to carry out that work. The service plan sets out how the service will be delivered, including premises inspections, and that programme is based on risk. It also relates to the targeting of various work activities such as asbestos, gas safety and working from heights. It covers accident and complaint investigations and other activities such as event safety, sports grounds safety, and construction products. The team primarily provide advice and support to businesses and help them comply with their statutory obligations. However, on occasions, enforcement action is carried out in accordance with the Council's enforcement policy in order to safeguard health and safety and protect consumers. And members of the Recommendations Committee endorse the service plan.
Okay, members, recommendation there before you. We get a proposer and a seconder. Proposed Councillor Jason Barr, seconded Councillor Paul Boggs. Moving on, members, item number 9 is the draft consultation response to the UK Department for Health and Social Care creating a smoke-free generation and tackling youth vaping consultation. Some title. Seamus, yourself.
Thanks, Chair. Members, this consultation outlines proposals to bring in legislation to prevent children being sold tobacco products and raising the smoking age each year until it applies to the whole population. The overall aim is to create a smoke-free generation. The consultation also sets out proposed measures to address youth vaping by restricting flavours in vaping liquids, regulating point-of-sale displays, regulating packaging to make them less appealing, restricting supply of disposable vapes, and introducing regulations which may also apply to non-nicotine vapes. The draft response highlights Council's support for the strengthened measures being proposed and highlights that measures addressing smoking and vaping will contribute to both the health and well-being of the population, but also help protect the environment as the disposal of lithium batteries are hard to recycle. The draft consultation also highlights the need for government to ensure that any enforcement services are adequately funded and resourced. And members of the committee is asked to consider and approve this draft response.
Thank you for that, Seamus. Councillor Deeney.
So I feel this is very timely, particularly after the motion I brought forward in State Council in September. We all know how readily available these vaping products are to our young people and the environmental implications they have. I feel Council's response here, in particular around the ban of flavoured vaping products and having the products behind the counter and not on display, is particularly welcome to make these products less attractive to our young people. Also, limiting the nicotine content in the products is a positive step. As I've said before, I'm a secondary school teacher, and speaking to teachers across the island, there's reports of a third of teachers saying the pupils are struggling to concentrate after they come back with these high nicotine levels. Therefore, limiting the nicotine volume would be very welcomed. And although it's a great step and it's in the right direction, our party still agree the way to eliminate the problem is to put an outright ban on the vaping products because they're being banned in the EU in 2026 due to these concerns. In the interim, though, we're happy to endorse the stricter regulations and support the enforcement plans, and regularly spot checking is vital in tackling the problem. So I'm happy to propose, and I just have one more wee point. So I believe there is a steering group set up to address the problem that officers from Belfast City Council are in attendance with. And I'm just asking if any of the relevant council officers could make contact with the steering group to see how our council could tie in, please.
Yep, no worries. Thanks for that. So you have proposed the consultation response. Can I get a seconder, please? Councillor McDade. Okay, members, moving on. Item number 10 is the food service plan for 23-24, and that's Seamus again.
Thanks, Chair. Members, the Council is required to produce the food service plan under the Food Law Enforcement Agreement set up in the year 2000. The plan sets out how Council will deliver the service and factors which may impact it. Outlined within the plan is the profile of registered businesses, which amounts to 1,700, and that consists of various restaurants, retailers, manufacturers, and EC-approved premises. It also outlines the scope of the food standards and food hygiene services, risk-based inspection programme, the food hygiene rating scheme, the food sampling programme, and food poisoning investigations, including out-of-hours arrangements. The service plan will be delivered within the allocated budget, and Council receives a core grant funding from the Food Standards Agency, which covers a substantial part of the costs. And members recommended the committee endorse the service plan.
Thank you, Seamus. Can I get a proposer and seconder, please? Councillor Devine. Opposed? Councillor McDade, seconded. Thank you. Item number 11, members, is Outscape Walking for All project. Barney?
Thank you, Chair. Members, the purpose is to seek your support of Outscape Walking for All proposal and confirm council endorsement of the Peace Plus application through partnership engagement. Members, Outscape are currently working towards applying for Peace Plus funding around theme 4, healthy and inclusive communities. And the proposed project they're looking at, Walking for All, is to use lead walks as a conduit to contribute to the creation of healthy communities in rural areas, while also tackling social isolation and promoting enhanced social inclusion. The project, members, is a cross-border involving councils and local sports partnerships. The proposed model for the project includes a core staff, team of project manager, finance officer, training and communications officer, and 3 regional managers. The overall size of the project is somewhere in the region of 6.5 million over 3 years. They've said it's not possible for Outscape to act as the employing body, so they're looking to local sports partnerships and councils to be the employer. The coordinator post that they're looking council to take on has been evaluated independently at SO1 staff officer, and all elements of the project is fully funded, members. They're also going to allow car users allowance, the built-in statutory redundancy pay, 15% towards administration and 7% towards the coordinator's travel and subsistence. It's anticipated the call for applications to the programme will close in early 2024. Then there's a 6 to 9 month assessment period. So, members, in terms of financial implications, there are none. That's 100% funded through Peace if successful. And the project will involve the employment of a local Walking for All coordinator on a 3-year fixed term. So the recommendation is to seek your support for Outscape's Walking for All proposal and confirm council endorsement of the Peace Plus application through the partnership engagement. Thank you, Chair.
Thank you, Barney. Councillor Devine?
Thanks, Chair. I think it's a really good proposal to help make the outdoors more accessible to everybody for them to enjoy, and really to promote the beauty of our countryside and the richness of the wildlife that's on our very doorstep. I think we all know the many benefits of outdoor activities. It's been well documented in terms of our physical health, connecting with nature and with others in group activities, on our mental well-being. Green social prescribing has now been recognised by our medical professionals as a viable treatment option and a preventative measure for our health and our well-being, promoting active citizenship, inclusion and participation. So there's many benefits. It's something you don't need any specialist equipment either for, and I think that is really helpful. Our council area is largely rural, and I think we're really privileged that many of us either live in the countryside or are very close to it and can enjoy it. I think our pandemic saw a boom in people visiting the countryside and experiencing the benefits of nature, but I think we do need to be mindful that we are considerate of farming communities about access into private land, and that we don't disturb our wildlife or damage their habitats. Education, I think, is really important to make sure that we're adhering to the countryside code, that we're promoting responsibility and respect for our countryside and those who live and work in it. And I think that's a benefit from the project that's been outlined, that there are walk leaders proposed for the project to support that. I've actually had a conversation recently with someone about a similar type of project, and developing a website that would help to promote walks and things like that. So I'm happy to propose that we support the proposal and the application.
Thank you very much, Councillor Devine. Councillor McDade?
Thank you, Chair, and thanks, Barry. I think it's a brilliant idea too, and even better that it's not going to cost the council anything, and it's going to get someone a job. I think, given the story that Caroline said in the deputation there about someone she was providing counsel to, who the biggest difference it made to someone's life was that they joined a dog walking group. It shows you the difference, not just physically, what it can do for your physical well-being, but actually your mental well-being as well. And in Grantia, every day, the University of Third Age is based over there, and every day you see 10, 15, 20 people who've just retired out walking the grounds, laying around, and they're loving life. It makes such a difference. So I am happy to second the proposal to accept it. Thank you.
Thank you very much, Councillor McDade. Members, item number 12 to 18 is for information, and I propose to take them as read unless anybody wants to raise any particular issue. No? Alderman Hussey?
Chair.
Yep.
Thanks for the opportunity, Chair. Under 15, the community toilet scheme. If I can get to it now, forgive me if I get there as quickly as I can. I know some people are in a bit of a hurry.
No, you take your time, Derek.
3.2, the addition signage. Can I just say that is to be extremely welcome. I have had a concern, as Seamus himself knows, with regard to indicating where community toilets schemes are actually working, and hopefully that will aid some of the difficulties that some of us experience in areas where toilets have been removed. I also welcome that there's a drive to bring more premises into the community toilet scheme, but I noticed that that's in Strabane Town. I would hope that it would apply to others beyond Strabane Town who might wish to come into the scheme. And just one question about the actual operation of a community toilet scheme. When you go into a premises where facilities are available, is it appropriate that you have to ask for a key to get into that particular premises? My understanding was where these are, you simply walk in and go straight to the facility rather than having to ask for a key. And one final point in 3.4, the painting scheme at the former Public Convenience Toilet Tourist Information Centre in Newton Stewart. What's happening with that building? There were proposals for that for community use, etc. Has that ever been developed, or is it just a vacant building? Thank you, Chair.
Thank you, Alderman Hussey. On the same topic, I've got Councillor Devine. I do have Councillor Duffy, Sandra Duffy, online, but I'm going to assume, Councillor Duffy, that it's a separate item.
Separate issue.
Yep, I'll come back to you on that then. Councillor Devine.
It's similar. It's actually similar to what Alderman Hussey has referred to. Just wondering, has there been any plans in terms of extending that out to Newton Stewart? I don't see any premises there on the map for that. And also just in relation to the premises, I know we'd spoken already, Seamus, about that old tourist information building, and what's going to be used for.
Seamus.
Thank you, Chair. I'll try and cover all the questions. In relation to Newton Stewart, we do encourage other businesses to participate in the community toilet scheme, and we've been liaising obviously with the library in relation to opening and closing the gate for security. There was a report brought into this committee in 2019 in relation to an expression of interest submitted from a local church group, and my understanding was that there was a planning application submitted following that, but as to where that has ended up, I'm not 100% sure. So we'll liaise with the church group and determine whether they're still interested, and if not, bring an options paper back into this committee for that particular facility. And in relation to Strabane Town, probably the main reason for trying to promote the community toilet scheme in Strabane Town is that we do have limited uptake and we want to increase that. And we're mindful that the public toilets have been closed as well, albeit there is alternative provision, but we want to increase it. Thanks, Chair.
Chair, the issue of the key.
The issue of the key, 99% of the businesses don't require a member of the public to use a key. There has been one example in Castleberg due to antisocial behaviour where the shop owner insisted that they needed permission. So we'll work with business and try and iron out whatever difficulties there are. But ideally, there shouldn't be a request for a key.
Thank you, Seamus. Councillor Boggs on the same issue.
Yeah, same issue, Chair. Just to very quickly commend the team for the work. I met with officers not that long ago on it, and I think we've moved pretty quickly from this was raised at full council just after the election to be able to get it, the signage that hopefully will not only help people find where it is, but I think the signage, as I said to officers that day in the meeting, hopefully it will entice other businesses to come on board whenever they actually see it. I think sometimes whenever these things are floated out to businesses and local properties and whatever else, community groups, it's kind of like a pipe dream that they think it's something that might come, but this is something that's actually available now. So I think the signage goes some way as well to helping us with the increase in the uptake in the scheme as well. So just to commend officers again on it. Thanks, Chair.
Thank you all very much, and thank you, Seamus. Councillor Sandra Duffy.
Chair, thank you. Mine is on item 13, the McMullen programme, and I just wanted to ask officers, do we know definitively that McMullen won't be funding this come next year? Because of my experience in terms of the McMullen programme, it has been hugely successful. I was able to attend a number of events last year with them, and the uptake of it has been fantastic. The participation in it is second to none. And I have to say, I wouldn't want to see that service diluted, because it is people who have a cancer diagnosis or who have come through a cancer diagnosis, and they really do come together in terms of their physical health and well-being, but also supporting in terms of their mental health and giving each other that sort of support network. So I understand in terms of bringing it into a wider context, but I think the niche element of the McMullen programme actually serves it very, very well. And I really don't want to see that diluted. So I'm just asking in terms of, have we had that definitive word that that funding is not going to come?
Excuse me, through yourself, Chair. Councillor Duffy, we haven't had definitive word, but all the indications are that the funding is likely to end. We are looking internally, and you're right, you've mentioned some really outstanding elements of that scheme in terms of that we wouldn't like to see stopping. So we are doing our own wee review of the programme and see how we can continue a lot of that stuff internally. Sandra, we are looking within the sports development team, not a restructure, but we're looking at jobs and stuff like that. So we are looking around this and around resources, how we can continue the vast majority of this going forward. But that'll probably take a wee bit of time, and we will bring something back in for our members' consideration. But yeah, points well noted. We haven't definite confirmation, but it's highly unlikely they're going to continue with funding. So we have to get a plan B to continue the great work that has went on.
On the same issue,
Sorry, just to say, you do, Barry, but can you keep us well informed, Barry, because it is a really important programme. Thank you.
Thank you, Councillor Duffy. Alderman Hussey, on this issue?
No, item 16.
I'll come back to you if about a list, all right. Councillor McDade.
Thank you, Chair. Very quickly, just on item 11, I just want to thank council officers for all. What?
Item 12.
Oh, sorry, item 12. Sorry. I want to thank council officers on all the work they did on the childcare stuff with employers for childcare. Follow my motion. Just whenever you look at the details, you can see there's 52 families had attended it, and there's been an increase in applications for child benefit in that. So I think it's something that will make a difference. So hopefully there's a number of families in Derry and Strabane that have a bit more money in their pocket for Christmas that they wouldn't have had if this hadn't went forward. So I'm delighted to see there's a plan going forward for the rest of the year to go across the rest of the places. So thank you.
Thank you for that, Councillor McDade. Alderman Hussey.
Thank you, Chair. Item 16, the Pride of Place Awards. Firstly, of course, congratulations to those local groups who did go forward last month to the finals. Looking forward to next year, under 4.2, a budget is in place for Pride of Place entry fees and costs associated with the award ceremony, etc. When do nominations open, and will we be proactive in encouraging groups throughout our district who are doing tremendous work, whether it be urban or rural, and encouraging entry or nomination for next year's awards if they are to take place? Thank you, Chair.
Through yourself, Chair. I'm not sure on the date, Alderman Hussey, in terms of when they actually open, but we can get that. It's a similar date most years, and yeah, we do widely promote it throughout the district through local growth partnerships, through our various community channels. But look, we will continue to do that, and if there are any suggestions around how we can further promote the scheme, we're more than happy to get those out.
I appreciate that, Chair. It's just I'm not aware of the issue. Haven't been raised at my own local growth partnership, but it may have been done at the meeting when they all come together, etc. The chairs, but it's something I believe that should be at the local level where, and then it's brought to the chairs meeting. Thank you.
Thank you for that, Alderman Hussey. No further items. Can I get proposer and seconder to go into confidential? Alderman Paul Boggs. Jason Barr, seconded. James, can we